here to have a first look of OmnyKare, a revolutionary health management technology developed by Omnyk. Omnyk was founded in the year 2015 by Mr. Bobra, Mrs. Joy, and Mr. Singh. Mr. Bobra, CEO and co-founder of Omnyk, has 30 plus years of experience in delivering leading-edge products and solutions in the semiconductor industry. Following his passion and key interest for technology, he was involved in a number of industry-first solutions with an unbroken record of first-time success. Mr. Bobra holds 8 patents under his name. Without any further delay, I welcome Mr. Yogendra Bobra to throw some light on Omnyk and the revolutionary life-changing technology being launched today known as OmnyKare. Please, sir.
Thank you, Reshma, for your kind, generous introduction. Appreciate it. Personally, I would like to welcome and thank everyone who has joined us for taking time to join us from the product launch event of Omnyk, what we call it OmnyKare, our flagship product. I would like to walk you through our brief journey of approximately 6 years, how we started to where we are today. The journey of Omnyk started with the personal need for me to take care of my mother's health remotely from far away. Myself, my brother, and my sister all had moved out of our hometown, Indore. And after passing away of my father and her desire to stay connected with her enriched circle of friends and other family members, I started looking for a solution, and that's how our journey started. After 6 years of hard work, lots of bumps in the road, and finally coming up with a digital healthcare solution that could serve our purpose. Today, I'm very proud to announce that we are launching a widespread commercial launch of our product. From the perspective of complete digital healthcare solution, people have different ideas of what that is. So I'd like to, for the benefit of those who may not be aware of it, the digital healthcare solution consists of 3 key elements. One is the device, a hardware device that collects body vitals under normal living conditions, not the ones that you see normally in hospitals wired up where patient cannot move around. Second is a device, an application on a mobile device where if the person is moving around, living a normal life, be able to collect the data, make it available for others to see it and or analyze it. And finally, the third piece is the cloud platform through which we can provide the patient-centric services. For example, we provide real-time alerts and customized reports for patients. I'm very proud to report that all of the 3 elements of the OmnyKare solutions were developed by the Omnyk team, which provides us a full control and a flexibility to provide customized patient-centric services. Our primary focus is the cardiovascular diseases. Idea of the magnitude of the problem, 31% of the total deaths in the world to cardiovascular disease. And if you look at it, it's about 18 million people every year due to vascular diseases. The other major challenge the healthcare professionals face is the high readmission rate after any cardiovascular intervention, which is about 20%, and statistically about 8% of those patients do not make it through. We are very excited that we may be able to contribute significantly in saving lives through identifying the signs of potential need for early care during this recovery phase. And and hence enabling the timely delivery of care. As they say that video is worth a million words, I would stop here and play a video that will describe to you in more in details how our solution works.
Meet Mrs. Smith. Last week, she had a severe chest pain and was rushed to the emergency room. After a week of care at the hospital, she is now back at home. While health is normal at present, her son Joseph, who lives in another city, is very concerned about her well-being. What if such a situation arises again? This is when her doctor told him about OmnyTrack, an easy-to-use wearable ring that continuously monitors a patient's key vitals and makes them available to the doctor in real time. Mrs. Smith notably finds OmnyTrack very comfortable and easy to use compared to other devices offered to her in the past. The data from the ring is constantly uploaded and stored in the cloud so that the doctor and the patient's emergency contacts can get real-time updates. In case of an anomaly, alerts in real time are issued to caretakers. These alerts avoid any delay in response and diagnosis, proving to be life-saving for many patients. Joseph can also track progressive developments in his mother's health through a simple dashboard on his phone. Meanwhile, the healthcare providers can monitor multiple patients' overall wellness through an easy-to-use web application. OmnyTrack's pioneering technology is providing an entirely new level of safety to patients, assurance to their families, and remote patient management capability to their healthcare providers. To learn more about OmnyTrack, please visit our website.
I would like to thank you all for your patience through this phase of our program. I will now hand over the platform to Reshma for the next part of the program.
Thank you, sir. Thank you for sharing such an insight. Now, I would like to call upon Dr. P.K. Hazra. Dr. Hazra is the head of Department of Cardiology and Director of Cardiac Cath Lab of AMRI Hospital, Jakuria, Kolkata. He has more than 25 years of experience in cardiology, in which he has performed 10,000 plus angiography, 2,500 plus angioplasts, and implanted 2,500 plus pacemakers, to name a few. He is a scientific chair conference, scientific convener of Society of Cardiac Intervention, Kolkata, and member of Cardiological Society of India. He is also a member of international societies like Fellow of American College of Cardiology, FACC. Now I request Dr. Hazra to throw some light on the disease burden of cardiovascular diseases and how digital healthcare solutions can be a part of patient management. Over to you, Dr. Hazra.
Yeah, thank you very much. I think we are into 2022. The cardiovascular disease is ever progressing in a number and also to the severity. Now, this is basically very important for Asian countries where we get this cardiovascular accident at very young age, and you need to diagnose them when they catch them very young, and many times we miss the early signals and early diagnosis. And if you have this kind of algorithm, then we can perhaps pick them up early by detecting them at home, and their vital parameters, which can be picked up by this remote monitoring, home monitoring, portable monitoring, what we are having for many years. But this technology has improved so much that it can be user-friendly, and that can bring hospital to the home and home to the hospital connectivity seamlessly. So I think this needs to be nurtured, and there should be more narrative, more discussion on this kind of technology to reduce the early deaths, premature deaths in Eastern Asian countries. And it is very important for us to acknowledge that we are living in an epidemic zone, seismic zone, and we have to act early, and we have to act differently from the rest of the world. Thank you.
Thank you, Dr. Hazra, for such an insightful information.
Thank you.
And now we are open to questions. Please unmute yourself to ask questions. So I have one question to you, Dr. Hazra. On the data analytics perspective, what parameters would you like to see?
First of all, data analytics, we have to diagnose the disease first, and early signals of the disease and the complication of the disease. Now we have these data analytics and different form of data analytics for different diseases. For example, if I talk about Parkinsonism, you have to go for the frailty index, the number of falls, the postural symptom, etc. For cardiovascular disease, when they culminate into complications and mortality, morbidity, their heart rate falls, their heart rate goes up, their heart rate becomes arrhythmic, their oxygenation falls, and their every picture of their physiological parameters, which can be picked up from the skin, but touching their skin, sensing their skin, does change a lot, and that can lead to early arrival to the hospital, early care, and sudden cardiac death, the syncope, the unconsciousness. Many things can be prevented and can be diagnosed early if you have this data analytics, which is very simple, which is very seamless, and which can be transmitted without any loss of data, will help the physician and the cardiologist, especially in this field of newer telemedicine and teletechnology and social medicines and other things which are coming up with artificial intelligence to diagnose, to detect, and to deliver healthcare by these machines, small machine, nano machines, to the people, to the doctors, and connecting people to the doctors. That will be a triangle between a patient and the doctor and the device.
Thank you, sir. And one more question to Mr. Bobra. Is this commercial launch going to be across India or for certain regions, sir?
Currently, we are launching in the eastern part of the India and the southern part. In the eastern part, we have 3 states, West Bengal, Orissa, and Jharkhand, that we have engaged with the hospitals and healthcare professionals. In the southern part of the country, we have Karnataka, Kerala, and Tamil Nadu that we have engaged. We would soon be expanding throughout the country.
Okay, thank you, sir. Thank you. And I think we have few questions posted. So one is like, how many hospitals are you associated with right now, sir?
Currently, we are associated with healthcare professionals from 10 different hospitals, and we are talking to other hospitals. That's one of the purposes of launching it commercially, that we are ready to support patients in the wider geographical locations. We are also addressing the public sector, working with the government, Ministry of Health, and address the need for the poor people in general. Because we obviously are going to be serving the wider audience, and we have programs where we will subsidize it for poor people. They need help and then cannot afford a solution.
And there's one more question as a company, how are you planning down the lane?
I'm sorry, sir.
As a company, how are you planning down the lane your future?
So we are any high-tech industry, innovation is key to it. We are continuing to work on next generation products. We will be adding new features like temperature, blood pressure, and on-demand ECG in the next generation products. We will be launching our products beyond India, starting with Middle East And then after FDA approval, we will be launching it in the rest of the world now.
Nice to know, sir. Thank you. And there's one question for Dr. Hazra again. What would you like to see the digital healthcare solution should primarily focus on?
What do you? I didn't get it.
What would you like to see the digital healthcare solutions should primarily focus on?
Okay, so digital healthcare, I think, is primarily to detect certain anomalies which can be detected by AI, and those can be delivered seamlessly, instantly to the physician for their actions. And the second will be follow-up of these patients at their residence when they are discharged from the hospitals back home, and they start feeling good. If you have some connectivity digitally, and that can enhance their confidence of good living, good quality of life. So that is a paradigm shifter. The way used to treat people, once they are admitted, used to forget them, and now they can be connected back to the physicians digitally. There are so many methods of connecting, but this is the best method, where you can see the data analytics, the blood pressure, oxygen, pulse, the vitals, which can be recorded for future reference, and that can be a baseline, a platform to improve any kind of therapy. There are many things beyond blood pressure, beyond physiology. There are many things like pulmonary capillary wedge pressure, the pulmonary artery pressure. There are so many newer things are coming, but definitely this kind of signature, digital signature of their health and the physiology can improve the further bonding of the patient to the doctors, and also well-being and the catastrophic complications of certain diseases, especially the cardiovascular disease.
Dr. Hazra, we agree with you that the long-term trend is a very important aspect of it, along with the analytics. And we are working towards providing a long-term trend of heart rate variability as well. So what's your thoughts on the trends of heart rate variability over time?
Heart rate variability was there an important parameters to detect sudden cardiac death by 24-hour step, Holter, and other loop recorders. And recently, it lost its, I would say, the acceptability and applications in cardiology, because there are many other indicators of certain channelopathies, dyselectrolytemia, sudden cardiac death, arrhythmic deaths. For example, we can pick them up by MRI, angiography, CT angio, etc. But this heart rate variability can be an indicator of future events like sudden cardiac death, arrhythmic deaths, and propensity of the signal average ECGs. Heart rate variability was there in the text, in the literature, in scientific publications. That can help to detect the arrhythmogenicity of young children. I would say that those young children suffering from channelopathies, they are the special candidates. Not as much in your very adult ischemic heart disease or cardiomyopathies or hypertensive with comorbidities. So heart rate variability, to be very honest, doesn't have much penetrations in the clinical practice. Certainly, we have come up with newer data or newer science where it can change the prognosis of the patient.
Thank you for your detailed insight into that. Appreciate it.
It was a pleasure having you with us, sir. They say requirement is key to innovation. Today's high technology, sedentary lifestyle is leading us all to grave health conditions, which silently impacts without us realizing unless it's too late. And considering the busy and fast-paced life, managing health of loved ones becomes even more challenging. Thanks to innovations in remote patient management system, which is making it easier and hassle-free to look after our loved ones. I, Reshma Bhimaya, your host for the evening, on behalf of entire Omnyk family, would like to thank you all for joining us today. Thank you once again. Thank you, Dr. Hazra. Thank you, Mr. Bobra.
Thank you.
Yeah. Thank you, sir.
Bye.